We launched a project. I don't know how many of you have heard part of this or not. So I'll just kind of start at the beginning and then we'll get into sort of the some of the results. But the Access to Care project was my brainchild coming out of trying as president. So I guess I should introduce myself. My name is Lisa Rantz. I'm president for Hawaii State Rural Health Association. And during my day job, I'm executive director for Hilo Medical Center Foundation. So I do a lot of work around rural health and advocacy. I'm not a clinician, but I work with supporting our family medicine residency program on Hawaii Island. And I was appointed by the governor to the Hawaii Medical Education Council. So I try to work with all the residency programs in the state to help develop rural rotations. We serve as the Area Health Education Center for Hawaii Island, recruiting students into health careers, supporting, like I said, the rural rotations, setting up clinical rotations, doing workshops. We have housing and transportation on island. So we purchased vehicles and we have housing on the Kona and on the Hilo side. So really trying to come up with sustainable solutions to connect folks into our rural communities, and hopefully we can, do this across the neighbor islands. So the whole idea behind access to care is we hear all these things anecdotally about folks not being able to access a provider. We know that we have more advanced disease, the hospitals don't pay the general excise tax. Our solo and small practice providers are out providing, that frontline care to our community, but they're burdened with the excise tax, lower reimbursement rates. So we're working with the congressional delegation as well. So my thought was, if we can bring all of this information together, the things we're hearing anecdotally, we can create a survey, do a community survey, and providers and community members can take the survey, and then we'll have some solid quantitative data to put with our qualitative data from our focus groups. So if we put it all together, then we can say, sort of back our legislators in a corner and say, here's what the real deal is. You've been hearing it for years, but now here's data to prove it. And so that was the thing behind the Access to Care project. So goal is to better understand what Hawaii needs to improve timely access to healthcare services. We know that there's a lot of great things happening. And so in the focus groups, we're asking, what do you need to continue to do the work that you do, right? What supports, what scaffolds? And then we get into the gaps. So this isn't all negatively focused by any stretch of the imagination. So like I said, we convene focus groups to gather that rich qualitative data, and we launched the pilot on Hawaii Island. That's where I'm boots on the ground, and we engaged with Community First, which was started by Barry Taniguchi, who's done a lot of stuff statewide, owns KTA Superstores. He's sadly no longer with us, but we created a physician subsidy program on Hawaii Island. He gifted that to me before he passed away. And I said I would take it as long as I could gift it to Hawaii State Rural Health Association, and we can change it to Health Profession Subsidy Program. And therefore we can take care of all the rural areas across the state. And one of the silver linings of COVID was getting some additional monies in. So we got $250,000 to put into that program, and we already had some money to start with. So we have over $300,000. We're working with organizations to help build that up. So I can send out a document about the different loan repayment programs that we've sort of instituted. But with that said, here are the partners that we brought together for Hawaii Island. As we move this project statewide, we're going to be looking to add to this list, and we'll be adding HMA to this list as we continue to move this project forward. The methodology that we used, and I kind of keep going back to this, is the focus groups. And we started with the systems, the healthcare systems, the Department of Health, hospital systems, the FQHCs, and then we got down to the Independent Physicians Association, and then to the providers providing direct care and the community members. We got 2,248 total surveys responses, so we did pretty dang good. And 225 of those were healthcare providers. And let me see here. So one of the questions that we asked was, do you feel that the community is healthy, right? And 55% of Hawaii Island residents felt that the community was healthy, but 4 out of 10 or 45% recognized the community is unhealthy. And then from the provider responses, they flipped that around. And so the vast majority of the respondents that we had of healthcare providers, 90% of them live on island full-time. So they're not the providers that are flying in. And their opinion was that 59% of the community is unhealthy, and 41% of them felt that the community was fairly healthy. So just a little snapshot into that data there. And then, you know, obviously one of the big things is our workforce shortages across the system that we're seeing that continue to get worse is the central problem. The shortages, primary and specialty providers, extends to case managers, community health workers, you know, CHWs, it runs the gamut. So if legislators say, oh, well, if the physicians leave, we'll put in APRNs or PAs. Well, we have shortages in those too. So we want to make sure that we educate them on that. And then we have a healthcare provider that says, you know, the field is lacking proper staffing. Outer islands don't provide specialty care due to no one having the opportunity to practice here or overwhelming patient to physician ratio. And I can share a little bit more data. The community said that, well, 76% of respondents said that it's due to a lack of providers. 56% said they have trouble accessing care due to the cost of care. And then 38% said insurance issues prevent them from accessing care. More than 8 in 10 survey respondents, or 81%, believe Hawaii Island lacks an adequate supply of physicians. So that's pretty significant. And then healthcare professionals concurred with that. 84% of responding physicians or providers said a lack of noted basically that the lack of providers is the most pressing issue when it comes to community access. So, you know, we're seeing that alignment between what the providers have been saying for years, and now this is the patient voice, the community voice concurring with that. And then along here, the waiting periods for specialist referrals, 48% report delays in services. And this is from the community side, with 19% of respondents saying that they had significant delays, and an inability to get an appointment was the chief reason for the delay in receiving care. So we're starting to, you know, really be able to show that data as it comes across. And economic issues, obviously. So the high cost of operating, our cost of living, lack of affordable housing, the tax burden with the general excise tax, increasing costs. I mean, there's things that are, you know, higher in practice costs here that you don't have on the mainland. Some things that you try to ship in, the shipping is more expensive than the item. And all those things need to be articulated. And then, as you all know, there's a lowest reimbursement rates for Medicare and Medicaid. And then we have 2 quotes here from providers that participated in focus groups. And these are from the surveys that they actually put in. So the bottom one, the cost of providing services has increased, but the reimbursement rate has decreased. Tax rates for GE are cutting into my very small profit margin as I'm not allowed to charge taxes. So, you know, educating our legislators that you can't pass on the GE tax on Medicare services, that it's actually illegal to do so. And we can share the documents from CMS with them on that, and then show them their tax guide that they give to patients that says, oh yes, your doctor can pass on the tax for your Medicare services. That's actually illegal. So they need to work on changing that. And then, the top one, working in Hawaii is a challenge, significant pay cuts in comparison to the continent/rural communities and the high cost of living. So we're seeing these patterns come up with that. And the other question that we asked that sort of relates to this, and I just got the data from the data analyst, so that's why the numbers aren't on this presentation. But our healthcare providers told us, a good number of them actually, that 49% have contemplated a reduction in their hours. 44% have contemplated a move to the mainland. And 47% have contemplated leaving medicine altogether. So that was nearly half of the respondents have thought one or all of those three things or a combination of those. So that's something when we report back to the stakeholders, we can delve more deeply into. And then how is this impacting our patients? We know our patients are sicker, right? They're not getting care locally, complicates the severity of their disease. And if they're told, oh, well, you need to see 25 patients in a day and you can only see them for one of their things, one of their chronic conditions, but if you don't take care of the other two chronic conditions, they're going to spiral. That's not helpful for our populations. So I know I just met with a couple doctors on Sunday that were newly graduates from our family medicine residency program that are sort of struggling with some of these things. Yeah, I won't read through all of these quotes here, but a couple points that I could bring up from our data is that our providers talked about the lack of certain specialties. And so on that list, of course, is our behavioral health counseling. 76% of respondents said that they're unable to get behavioral health when they need it. 70% said psychiatry. And then, of course, endocrinology, dermatology, cardiology, ENT, nephrology. So all of those really ranked high as not being accessible on Hawaii Island. And, I'm not one to pass on just a lot of bad news. There is a glimmer of hope that came through. We did have community members, 70% say that they were able to get their medical needs met on island, albeit if it was quite delayed, right? So, they had to wait, but they did end up getting the care. And for those seeking specialists, 71% said that they were able to eventually get care, but with delay. So that's what we had there. And then the future of the project, I mentioned that we started on Hawaii Island. We're going to be starting the provider focus groups in March. So we'll get you some dates out for that so you can participate. So we encourage you to do that. And then we're going to open up the statewide survey in April. And so we're going to take all of this and put it together in a nice report to highlight those policy changes and other things identified from these surveys and focus groups to really move the needle forward and have something actionable, right? Because it's one thing to continue to report on shortages year over year, but not come up with solutions to do that. And we do have some grant funding with the Rural Health Association to do sort of a project on each island to help move that forward. So this isn't just a one and done. This is the start of something that we can build on and continue to move forward with momentum. So I'm happy to answer questions. We are going to be putting out the report shortly with the numbers, some of the numbers that I just gave you, and then the other numbers. But I literally just got them at 2 o'clock this afternoon. So super excited. And then Mark has my contact information, but it's here as well. And then Randy Kurahara is the Executive Director of Community First. So we're the lead organizations working on rolling this out statewide.